A few people in the state sector have been pushing for a long time that we need to do more data sharing across government, and when we try and do that, we meet a lot of resistance often. What I'd like to do today is to share with you some of the work that we've been doing to show you really why we're motivated to do this. Why is it good for New Zealand if we can do more data sharing across government? I'll do this by sharing with you this example of Marc Smith. Okay, so if this is a person who's engaging, we see at this point they're engaging with Youth Justice Services. The police here have found them doing something naughty and have sent them through, and they've had a family group conference and gone into care in a youth justice residence at the age of 15. They'll have KPIs relating to, well, I know they do have KPIs relating to YJ activity. So how well am I managing all of the people who are coming through my youth justice services, and how well am I keeping them secure, and all of that sort of thing. When you start to have a wider view, if you can share data and you share it with the Child Protection Agency, Child Protection Services, you start to see that this person's this wasn't their first engagement with the state sector. They've been engaged since the age of 11. They were notified here, and that's a physical abuse finding, and they went into care temporarily, were taken off their parents for a brief period of time, and then for more extended periods of time they were re-notified and then went into youth justice. But if I look back even further, that physical abuse actually was happening at 8, and this is sexual abuse here. And indeed, they had behavioural difficulties at 6, go figure, and were sexually abused at the age of 5. And actually, we knew about them as early as 3. So this is the first notification we have on the record, and the person who investigated that found behavioural difficulties. So quite possibly there was something going on here, but we don't know about it. When you then move up to here, two things become obvious. One is that this person has a history which may inform some of your decisions at 15. If you're in the youth justice residence, you probably just don't want to give them a light touch service. You might want to give them more intensive services. From the other perspective, from care and protection services, clearly youth offending is one kind of outcome that might occur from serial physical and sexual abuse over many years. And if we look into the future, where's this person going? We've also shared this data with education data, and quite interestingly, they've got some subjects at NCA level 2 and stayed at school, left a little bit early but went back to school briefly, which are all positive signs. And we know from this education data also that they had some tertiary training, which, given all of this history, is no mean feat. They've clearly got some talents and some hope for the future. When we share data with Youth Transition Services, that's a service where we're helping kids adjust to adulthood who are in need of intensive service. So clearly at this point somebody was recognising this person was high needs, and maybe that service was effective in getting them back into training, which would have been a great outcome from that kind of service. Nevertheless, when we look at their benefit payments from work and income services, they have received a youth benefit, an unemployment benefit at 18. And indeed, when we share that data with our corrections colleagues in the justice sector, you can see this person has started offending as a young adult. You can go one step further and add up the costs to the state sector, just fiscal costs at this point. You can see that we've trickle spent over a long period of time, and we're starting to pay some really big money now. The main point I want to make here is that people in various services like child protection and youth justice and education and youth transition services, work and income, people who find you jobs, and the correction system are all accountable for their little piece of the puzzle. But there is nobody accountable for Marc Smith, is there really? Who in the state sector is responsible for this kind of pathway? Nobody, as far as I can see. And typically this pathway is not even visible. It's taken an extraordinary effort to pull even this limited amount of data together. Nobody's accountable for him. People are accountable for service delivery, not outcomes to individuals. And this is clearly an outcome. There's a fiscal forward liability. But it's also a social forward liability. You know, the social impact of being an offender, all of the victims this person has, and them actually, to my mind, are a victim themselves of a system which is focused on services and not on outcomes. In case you think this is unusual, it's not. There are thousands and thousands of people in New Zealand who have this kind of profile. Here's a more recent look at data. This clearly shows the same kind of pathway that we saw with Marc Smith. This is more at the extreme end. By 33, this person has cost us $1.7 million. We were only spending $10,000 whilst he was sort of a young teenager. Perhaps 10% of that 1.7 million, what would have that been? 170,000? If you could have spent 170,000 when this person was 8 or 9 or 10, imagine what kind of outcome you could have achieved. We know there are services that work with kids with behavioural difficulties and that, but we don't really invest in these people until they hit this point. And New Zealand has a choice, really. Do we want to keep paying for prisons, or do we want to spend some less money up front to get a better outcome into the future? And one thing that enables us to do this kind of investment and be more secure in tracking the outcomes of our investments is having this shared data. You can't do that kind of long-term investment without this kind of data and without being able to see these kinds of issues and make people accountable for longer-term pathways and not just delivering the particular service that they are narrowly accountable for. It's frankly absurd to me that we don't share the data. I'll show you what I mean. If we think of society as having a collection of individuals who self-organise and they aggregate all of their tax, all of their money and their authority to a bunch of people who we call government, and that government has a job to make decisions about what kind of services go to what kind of people. The problem with this picture, when you provide a service to somebody down here, you collect data about them. So perhaps this person has a sore arm and they're treating their arm, so they've got arm data in here, and perhaps this person's treating their head and they've got head data here, and perhaps this person's treating their leg and they've got leg data here. That data comes back into these agencies, and it's generally the data that gets used to go back up here and to help the cabinet and decision makers to make a decision. But of course there's a couple of flaws with this, isn't there? That data is all piecemeal data based on a very narrow view, so maybe that's doctors' data and that's youth justice services data and that's child protection data. People are only seeing part of the picture, and of course they have a narrow interest in the kind of service they have and a narrow interpretation of the data as well. If this is health professional, they're thinking about it in terms of health. But we aggregate authority and tax so that governments can make good decisions. Why aren't we aggregating the data as well so that we can see the full picture up here and make better decisions? As long as that data's in my hands and nobody can see it and link it up and see what's really going on, then they won't be able to judge that actually this service doesn't work and this one does, and this one's of marginal benefit, so my decision will be to do more of this for this kind of person. We cannot hold people to account, we cannot choose which services are best, we cannot fully understand the outcomes of our investment unless we can track people through services, across services, and over time, like I showed you before. That's why I think we need to be sharing data, getting it up to the proper decision makers to let them question which services work. The good news is that we're starting to close that loop and make progress. Work being done on the Ministry of Social Development is using operational analytics and joined up data to better understand who their clients are and understand their health and education and justice sector needs, and see them within a bigger context. And we're starting to use this sort of thing to measure outcomes, to try and invest early when problems are smaller, cheaper to fix, and more likely to succeed rather than later. And real progress is being made. However, the Ministry of Social Development is just one silo in the state sector. And in 2011, I pitched the idea of having whole of government analytics at the centre of government, and the Treasury was a place where this could be put conveniently, but the idea here is that data from all of these kinds of agencies gets fed directly to Treasury, so that Treasury can start to make decisions about which services are working and which ones aren't, and how to better invest to get better outcomes from a more independent position than a service provider. Of course, this requires that these various other agencies in the state sector share their data, and we also invested heavily in what's called the integrated data infrastructure, which is really where this administrative data gets matched together and anonymized and is made available to independent people to start to use it. So that loop that we were talking about before is really starting to close, where the data is not just going back into the servicing silos, but is actually being used to look at the big picture. And I think that'll lead to some really good kinds of innovative solutions about how to solve more intractable problems. One other part of this is, of course, the Data Futures Forum, where we're starting to ask the question, why is it just the bureaucrats have access to this kind of information? What about iwi, NGOs, private sector providers? What makes us think that people in Wellington who have all of the data are the best people to decide what should go on in a local community or somewhere else? The value proposition for management of government in allowing better access to the rest of New Zealand to what is essentially New Zealand's data is that we'll get more open and transparent government, and we'll be able to see directly as members of the community ourselves what the performance is, and not just have to believe what the Treasury, the Minister or the Ministry says. So I think that's a huge advantage. Again, of course, we don't want to let Marc Smith's deeply personal information in an identifiable form out so the rest of New Zealand can gawk at it. There are some challenges with how we manage this well and make people accountable for misuse of this kind of information. And those are the questions which the Data Future Forum is really set up to try and tease through.